Welcome to SLP Nerdcast, your favorite professional resource for evidence-based practice in speech-language pathology. I'm Kate Granbois.
And I'm Amy Wonka. We are both speech-language pathologists working in the field and co-founders of SLP Nerdcast.
Each episode of this podcast is a course offered for ASHA CEUs. Our podcast audio courses are here to help you level up your knowledge and earn those professional development hours that you need. This course, plus the corresponding short post-test, is equal to 1 certificate of attendance. To earn CEUs today and take the post-test after this session, follow the link provided in the show notes or head to slpnerdcast.com.
Before we get started, one quick disclaimer. Our courses are not meant to replace clinical advice. We do not endorse products, procedures, or other services mentioned by our guests unless otherwise specified.
We hope you enjoy the course.
Are you an SLP or related professional? The SLP Nerdcast Unlimited subscription gives members access to over 100 courses offered for ASHA CEUs and certificates of attendance. With SLP Nerdcast membership, you can earn unlimited CEUs all year at any time. SLP Nerdcast courses are unique, evidence-based, with a focus on information that is useful. When you join SLP Nerdcast as a member, you'll have access to the best online platform for continuing education in speech and language pathology. Join as a member today and save 10% using code NERDCASTER10. The link for membership is in the show notes.
Hello, everyone. Welcome to SLP Nerdcast. We are really excited to welcome 2 repeat guests today back onto our show for sort of a part 2. We are really excited to welcome Heather Casca and Karina Kadi. Welcome.
Hi. Heather and Karina, you're back here on the Nerdcast to discuss how to apply clinical skills in dyslexia and any of our listeners who might not have heard your previous recording with us. Can you please tell us a little bit about yourselves?
Sure. I'll start that. So my name's Karina. I am an SLPA. I've been practicing for about 9 years now, and I've only worked in pediatrics. So I love working with littles. I have a passion for early language development and that type of intervention with littles. And Heather was my first supervisor for my first job, and that's how we met. And we quickly became a great team and a great pair. Yes, that's a little bit about myself.
And I'm Heather. I have been a speech language pathologist for almost 10 years now. I started off my career in skilled nursing, working with adults for about 1.5 years, but quickly learned and knew that my heart was with pediatrics. And so working in pediatric clinics, I found a love for literacy and reading and started doing a lot of extra education, continuing education on dyslexia specifically. I'm also the current president for the Arizona branch of the International Dyslexia Association. I live in the Phoenix area and I own a small private practice in addition to our dyslexia education platform with Karina. And I have 2 small kids. I have a 1st grader and a 3-year-old. So we're excited to be here again.
Well, we're so excited to have you. The first episode that you all did with us was really focused around the role of the SLP in the realm of dyslexia in general. But today you're going to be talking a little bit more about clinical application, which I am very excited to learn about because I know very little. So before we get into the good conversation, I do need to read our learning objectives and disclosures. So let's get through that and then we'll get on to the good stuff. Learning objective number 1, list the 3 principles and 6 key elements of structured literacy intervention. Learning objective number 2, describe 3 evidence-based intervention techniques and approaches to managing dyslexia. And learning objective number 3, describe 3 ways to incorporate structured literacy interventions into your current treatment plans. Disclosures. Heather's financial disclosures. Heather received an honorarium for participating in this course. Heather is the owner of a private practice called HBC Language and Literacy. Heather is also the co-owner of Soar with Words, LLC, and co-manages the Soar with Words educational platform on Teachable. Heather's non-financial disclosures. Heather is the current president of the Arizona branch of the International Dyslexia Association. Heather also co-manages the social media accounts for Soar with Words. Karina's financial disclosures: Karina received an honorarium for participating in this course. Karina is also the co-owner of Soar with Words LLC and co-manages the Soar with Words educational platform on Teachable. Karina's non-financial disclosures: Karina co-manages the social media accounts for Soar with Words. Kate, that's me. I am the owner and founder of Grandbois Therapy and Consulting LLC and co-founder of SLP Nerdcast. My non-financial disclosures: I'm a member of ASHA SIG 12 and serve on the AAC advisory group for Massachusetts Advocates for Children. I'm also a member of the Berkshire Association for Behavior Analysis and Therapy.
Amy, that's me. My financial disclosures are that I'm an employee of a public school system and co-founder of SLP Nerdcast. And my non-financial disclosures are that I'm a member of ASHA Special Interest Group 12, AAC, and I participate in the AAC advisory group for Massachusetts Advocates for Children. All right, Heather and Karina, I know you're here to talk to us today about intervention, but before we start, can you start us off by telling us just a little bit about dyslexia, maybe just a brief overview about dyslexia?
Yeah, absolutely. So I think one of the most difficult things about dyslexia is there are a lot of common misconceptions about what it is. But one of the biggest issues with dyslexia is just identifying it. And I think a lot of that comes down to the fact that there's really no one agreed upon definition. So the International Dyslexia Association has a definition that most people go by. However, there's still a lot of disagreement across professionals as far as what really is criteria should be included in that definition. So we really like to go by the definition. So Dr. Tiffany Hogan and Dr. Hugh Katz put out a paper in 2021 called Dyslexia: an Ounce of Prevention, Better Than a Pound of Diagnosing and Treatment. And so the definition that they kind of proposed is dyslexia is a severe and persistent difficulty learning to read and spell words despite adequate opportunity and instruction. And the reason we really like this definition is because it's not specifying like any distinct causal basis, but it's looking at it like multiple factors. So you're looking at a lot of looking at the whole child and what could be some early indicators for dyslexia. So it's really going to fit more in that preventative model, which is what Karina and I are really passionate about, that early identification and our role as SLPs and SLPAs on how we can help with that early identification and early remediation. So it's going to allow us to really identify those risk factors early on. And then also, it's a big part of it is that definition is it's going to be more easily operationalized in like those educational settings, because we find that most of our educational systems are still set up for that let's wait and see model, that wait to fail model for these students, which is really putting them at a disservice. Okay. We talk a lot about the dyslexia paradox, which was kind of a term coined by Dr. Gabb and her colleagues. And what the dyslexia paradox is that it's acknowledging that dyslexia is not typically diagnosed until second grade or later, which is past that prime time for intervention. So we know that research is showing us that reading interventions are significantly more effective in kindergarten and first grade. So most of our students, though, we're waiting, let's wait and see, they just need to keep practicing. And so they're not being identified until second or third grade. So we've already missed that prime window to have the most effective intervention in place for them. So some early factors that we need to consider when we're trying to identify these students is family history. So if there's an older sibling that may have an IEP or has struggled, that's going to be a big indicator that a student is not going to be one that will just catch up necessarily. I learned really quick early on when doing evaluations not to ask specifically about dyslexia, because I would say 8 times out of 10 I would get no one has dyslexia in our family. But then as you would ask more questions, you would find out, well, dad got help for reading in school, or so and so didn't, or I really struggled, I didn't like school as a parent. And so that right there, most people didn't get that diagnosis. And so it's a clear indicator that there is a family history of learning difficulties. And then also just that poor response to adequate instruction. So if they've been in preschool and they've been in kindergarten and their attendance is good, but they're still just don't seem to be picking it up, that's another indicator. Delays
This one
in
gets
speech.
tricky has gotten tricky recently, huh, with COVID.
Absolutely. And that's such a great point. And so we've heard that a lot too, especially, with our second and third graders now, because they haven't been identified, which is not necessarily atypical, but a lot of it goes back to, well, they were in kindergarten during COVID. And absolutely. I mean, I think everyone is struggling now because of what happened in COVID, but we really need to remember to look at all these other factors too, and not just like, it can't just be an automatic, well, it was because of COVID, like everyone's behind. You're right. Everyone, yeah, everyone is behind, but we have to make sure we're really doing our due diligence of like looking at the whole child and other early indicators. So, and that could be that family history, delayed speech and language skills. Maybe if, they have they're really struggling more with that phonological processing, working memory, phonological awareness skills. Some other factors to consider: any visual processing or executive function difficulties, and then even trauma-based interventions are going to be really helpful for these students too, as well as just looking at socioeconomic status as well. So I think when we're trying to identify these kids early on, need to really look at all these other factors that are going on as well.
And chances are, especially like in these early ages, we find that we're identifying kids that are already on our caseload for speech and language services. And so then in the intervention and in the time we're already spending with them, we're kind of picking up and noticing some of these other factors and things. And that's kind of a point we always like to make, is that most of these students are already on our caseload for speech and language at that age, but not yet identified for those reading difficulties.
Well, that's such a good point. I wonder if you can talk to us a little bit about, I know literacy and reading is within our scope of practice, but when you're in a school in particular, like that's probably not your chief role in that position. But can you help us understand a little bit about just the science of reading, structured literacy? Like, what are some important things there for a speech language pathologist to be aware of, even if it's not like the hat that we're wearing in our role in that job?
Absolutely. That's one of the biggest, that is the biggest piece that we like to bring to awareness is, we're lifelong learners, and even you said it perfectly, in a school setting, that's not our main role. We are not the reading interventionalist. We are not the one doing really addressing that. But if we can be aware of how many of those elements of structured literacy fall in our wheelhouse, we can give like heck of support, right? So when we're talking about structured literacy and the science of reading refers to just that body of research that comes from many different professions, and that kind of helps us understand how our brains learn to read, right? Because if we can understand how we learn to read, then we can intervene better, and we can help students learn better. And so that's what we're referring to for the science of reading, whereas structured literacy is just evidence-based practice approach to teaching those reading skills based off of the science of reading. So when we're talking about structured literacy, there's 6 elements of it. So syllables, semantics, phonology, morphology, sound symbols, and syntax are those 6 areas. And so there's 2 of those that aren't necessarily closely related to our field or our skill set, and that's being syllables and sound symbols. But we also want to talk to you about how you can support those in intervention as well. But the other 4 big ones, syntax, semantics, phonology, and morphology, those are language, right? We're already addressing that in the therapy that we're doing in our speech room. And so if we could be more intentional about maybe supports we embed, the way we scaffold, then we're supporting literacy skills in the therapy we're doing. And so to kind of go along with the elements of structured literacy, it also has 3 component, or how would I describe that, Heather?
Principles.
Like 3 principles. Thank you.
Mm-hmm.
So that it's explicit, meaning that there's like direct teaching. We're not assuming that a kiddo knows something before that we're teaching everything explicitly. Diagnostic, and so it's has individualized instruction that's monitored by ongoing assessments and stuff. And then the last principle, that it's cumulative and systematic. So it follows a logical order, and that each new step builds on concepts that we have already explicitly taught that child. So in a nutshell, that's structured literacy, those 6 elements and 3 principles there. And you can see we have a lot of knowledge in most of those elements, and not that we have to be the ones doing that direct intervention, but man, we can really support those underlying skills.
Well, and I would think that sorry, Kate. I would think that there are just so many opportunities, as you mentioned, and many of these students are already on our caseload. We're already providing speech and language services. Many of these 6 areas are things that we're maybe already working on as part of our speech and language goals and objectives. And then maybe it's also just a matter of being very thoughtful about the material and activities that we're selecting, because there are a lot of ways to work on different goals and objectives, right? I mean, I think the longer you've been in the field, the more you're like, I could work on it with this activity, this activity, this activity. They're all different ways to target these skills. I didn't know if you wanted to, if you guys wanted to give us some examples of how a speech and language session might look a little different when you're being thoughtful about trying to address the literacy component within your activity compared to when you're not.
Sure. One of the, I think the easiest ones to support is phonology, especially obviously when we're working on those speech sound goals, whether it's more articulation based or whether it's more of like a phonological process. Some of the things that we do to support phonology or that range of phonological awareness, rather, for these kids is visual supports. And we mentioned last time, so different ones like the Bjorm or LIPS. There's different like dedicated programs out there, but really blocks. We love blocks. We love wadded up pieces of Play-Doh and toilet paper, tissue, whatever we can get our hands on that can serve as a manipulative, and to just bring awareness to the individual sound that they're working on, because without awareness, there is no generalizing that skill. And so we can work with a kid on how to make their S sound till they're blue in the face, but if they don't know when to apply it or when to use it, then we're not going to see that generalized as quickly. So really using manipulatives and visuals to support their phonological awareness so that they can then apply what we're working so hard on with them. We like to, I'm just looking at my pictures here for that. Some other things that we do in the speech room for that kind of piggyback off of phonology are also support the sound symbol aspect of structured literacy. And those same visuals, those sound cue cards, can easily be adapted by just writing the grapheme or that orthographic representation on the letter for them. By tying that sound to the visual letter is going to support them huge. And just writing it out on that is another way to incorporate that sound symbol aspect of structured literacy without having to teach them the alphabet, right? Like it's just exposure, just modeling that. What are some other ways?
I was going to ask, you've mentioned the name of this episode that you've proposed is Outside of the Box. Yeah. Is that sort of what you're getting at here? Can you tell us a little bit about how this might differ from what we would typically think of as literacy instruction?
Yeah, it's a great question. So I think a lot of times as SLPs, when someone brings up, dyslexia intervention or reading intervention, our automatic go-to is, well, I'm not trained. I'm not trained in like a specific program. I'm not trained in Orton Gillingham. I'm not trained in Linda Mood Bell or the Barton program. There's a lot of really great commercial programs available that are Orton Gillingham based or structured literacy based, that are helpful to support these students. But our whole thing is, especially in the schools, when that's not our primary role, we don't necessarily have to be trained or certified in these specific programs. So thinking outside the box is more of like using our clinical skills. You know, we already know, like Karina mentioned, 4 out of those 6 elements those are in our wheelhouse. And these other 2, you know, they're fairly closely related, but easy to support once you have some general knowledge about it. And so you don't necessarily have to be trained in this program or, you know, certified in a certain type of intervention to support the students on your caseload. As I think, especially in the schools, as a school-based SLP, it's important to be aware of what curriculum or intervention programs are being used, you know, in the classroom or even in like an ESS classroom, to have a better idea of, you know, what the student is being exposed to, but to necessarily be trained in it, I don't think is necessary to support your students.
I really appreciate that perspective. What I've learned from you all and from a few other individuals over the years is that literacy can feel very siloed because of the different roles we play, particularly in an education setting where you have a quote reading teacher. And that's the person who does the reading intervention, right?
Only them.
Right. And so I think because we have this, I don't know if the word culture is the right word, but because you might have this professional workplace culture or set of standards or norms where reading might be a little siloed, I really appreciate the perspective of trying to branch outside of that and generalize some of these or create normalcy around intervening,
addressing these things,
addressing them.
Yeah.
Exactly.
Mm-hmm.
Yeah.
And we do get a lot of like pushback I wouldn't say pushback, but feedback in that, well, that's not my role in a school. I can't look for all these other students. I can't go add on these additional students and screen more students. And that's why we always like to emphasize, like, chances are they're already in your classroom, right? Like if we can just focus on that population, we're making a difference, right? Because we might have a little kindergartner, first grader working on these things who's not going to be screened or identified for any literacy related difficulties at that age, you know? So if we can kind of embrace, like be open-minded about that and embrace that lifelong learner kind of mentality and bring more awareness to, hey, what are some other factors that these kids already sitting in my room to help identify that?
I think too, so a lot of states now do have legislation in place where, you know, you have to be screened. There's universal screeners that are administered to all kindergartners first. It's usually like kinder through 3rd grade. And so finding out, like, if you have students on your caseload, or if your school has that RTI model where you're doing, you know, RTI with some of these younger students, find out about those universal screeners. How are they performing? Are they below benchmark? Because those are kids too, you know, that might just need extra support. Here in Arizona, if they are, you know, kind of flagged on these universal screeners, then they are automatically put into a tier 2 intervention. At one of the charter schools I worked at, I did part of the tier 2 intervention. We did that. And so we started an RTI group for some of those kids that were, you know, that had more difficulty with the phonological awareness. And so that's what we were doing as part of that tier 2. And I know that's not, you know, realistic for all SLPs. Like, we have a lot on our plate already, especially in those school settings. But I think just being aware and asking those questions, you know, I have so-and-so on my caseload, how'd they do on their screener, you know, and then just finding what additional supports you can give them, you know, during your speech and language therapy.
I wonder if it makes sense to talk a little bit more in depth about each of those different structured literacy elements. I don't know which one you guys would like to start with, but I think just giving people an overview of the element and then just talking kind of specifically about, so like I thought, Karina, you gave a great example of just if you're working on sounds, you could integrate that sound symbol correspondence component, you know, so maybe just talking about some of those tips would be really helpful.
Okay, I want to give some more examples for how we can incorporate some things we can do in our speech therapy to support that sound symbol element. That's not an element that that falls under that language domain, like a few of the other ones. And so we already mentioned the sound cue cards, and then just using the visual, incorporating that visual grapheme when you're working on your sound. So just make that help them build that association. Another thing I like to do is I like to make sound cards, I guess you can call them. And so say we have a kiddo working on S. So we might have on our little index cards all the ways that he might come across the sound when he's reading. So S will be on there. SS is also on there because at the end of words, it comes across that way. CE, CI, CY is on that card also. That way he knows visually, these are, when I'm reading, these are all the ones where I'm going to have to use my snake sound or whatever sound I'm working on. But also I'm just exposing them and modeling and just bringing awareness that, hey, this can be represented different ways. These are all I'm not his English teacher. I'm not going to quiz him on it. I'm not going to, it's just one thing that I'm embedding into my therapy to support that sound symbol component of, I'm not going to test them or quiz them, right? But just something I can embed there. And I really like that. And the kiddos really like it too, because then we can go and do reading tasks and they can search for those and highlight them and then practice reading at a sentence level maybe.
And just to
No, go for it.
Sorry, I was just going to say, just to contrast with that, like I can think of an example from when I was working outpatient and I would be working on articulation and I would go through my like super duper articulation cards with the pictures on them. And I would never draw that connection. I would just never make that explicit connection between the orthography, like the written symbols,
the written representation.
And again, that's not, we're essentially both doing the same thing and working on that target sound production. But what you've done in your approach is you're just making that much more visible, explicit, giving that student visible. And I love it. And I think it feels like such a small thing. It seems like
it's
it would
easy,
be very
right?
easy.
Yes. Yeah, it's an easy thing. And again, we're not fancy. When I say note card, usually it's like a ripped piece of printer paper that I'm like, oh, here's a little square for you. Here's your card. Or I have them make it, right? They can pick whatever medium they want to write it on, and then it's more exciting for them. And so you're right. It can be very easy and very low prep to be able to do that. Sound walls are another. I personally have never had a sound wall in my speech room. I wish I would have, but I want to make one. And then it would be a great resource to even have just like maybe collab with teachers and have in the classroom setting, those sound walls are a great way to help tie in that sound symbol when you're working on your speech sounds. We also, let's see, we won't go into syllables yet because that one can get, well, never mind. Yeah, we will, because this one can be easy. So syllables is probably the one of the elements that we know the least about as speech therapists. There are different syllable types and also different syllable division rules. But the most important thing to know about syllables is why it's important, why it's part of structured literacy. Is because when students can predict what sound a vowel is going to make by knowing the type of syllable, it's going to make reading and spelling easier. So knowing how to break that word into syllables essentially makes them easier to read and spell. So if we could explicitly teach them that, we're giving them a tool to support their decoding and spelling. And so the different syllable division rules, they can get kind of tricky, but again, that's not our role, isn't to learn this and teach them this, but just we take that approach of that we're lifelong learners. And if we can have this in our toolbox, then we can support kids just one different way. So we have some pretty good resources that explain this in a little more depth on our Instagram site. And so we have some, I think they're called reels pinned, saved on there. Highlights.
I think it's a highlight.
They're on our highlights. And so you guys can check those out, and those go into a little bit more depth in this syllable component. But ways that we have used this in our therapy is like reading comprehension. Sometimes our kiddos get stuck on decoding bigger words. And so we whip out our syllable division tools and kind of teach them how to segment and break apart those words to make it more manageable for them to read. And then they've decoded an unfamiliar word and now they know context. And so really just functionally using it, right? And so if we can bring this syllable type and syllable division knowledge just to our attention, it's just another way to support them.
one thing that I've noticed, or that a pattern I've kind of seen in the schools too, is oftentimes we are asked, like SLPs and SLPs are asked to like, can you give so-and-so their spelling test this week? Or like, we help support, administering spelling tests. And so if you do that, this is also another way, just having this knowledge that's going to be helpful. So kind of backing up a little to like the sound symbol. One thing that we found, especially with our older students, that, like gaps that we find is just even that basic awareness or knowledge of what a consonant versus a vowel is.
Oh, yes.
And then even like long versus short vowel sounds. So that's going to also be really important for that syllable division piece, because it like certain syllable types, like if it's a closed syllable, it's a short vowel. But if your second grader has no knowledge of what a short vowel is, that's not going to be helpful for them either. So I think that's a big piece that we often miss and overlook that we can be really supporting too, is just that basic knowledge of like a consonant versus a vowel, like, visually looking, and can you show me which ones are your vowels? But then even, like orally giving them a sound like is that a long vowel or a short vowel, and really supporting that. Because one thing I've seen before too is they would give these visual supports for this student who was doing for like spelling tests. That was part of it in his IEP, where they would just underline for however many sounds there were in the word, there was that many lines. So it was helping him as far as that phonemic awareness. But then they would also put little dots underneath the line that were supposed to be vowel sounds. And he was still writing, consonants where those dots were. And it was like, well, that's a vowel. Come to find out, the student had no idea what a vowel was. Like he could not picture or understand. So that those supports weren't even supporting him because he didn't have that. And so I think just even that, that knowledge is something that we often overlook, especially in our older kids, where I found that that's one of the biggest pieces that's, hindering. I don't know if that's the right word, like,
the barrier, you're right.
Yeah, thank you. That's right. A barrier to them with more of these, like the syllable type, so.
And everything that you're both saying is making me think so much about the opportunities for collaboration. So if that student is already on your caseload, making time for that 5-minute conversation with the classroom teacher.
Yeah.
Where does this student, where do you suspect they struggle? What are some of the literacy related goals? Or maybe it's not the special education teacher. Maybe it's the gen ed teacher. Maybe it's the quote reading specialist or the resource room person. I mean, every district has different labels for this, which is one of the reasons why I find this to be such a murky area, depending on where you are. But any collaboration with a literacy oriented specialist can create so many additional opportunities for generalization. I have to assume.
It. You're absolutely right.
And that was a big piece we talked about in like the last episode, is one of our roles, like under one of our domains, is collaboration. And so especially with these students, and I've been fortunate in the schools I've worked in. I come in obviously with a lot of background and knowledge and literacy in this area, and was a little nervous at first coming into the schools, thinking, that they're going to be like, whoa, like this speech therapist needs to stay in their lane. Like they're not a reading specialist. But I've been really fortunate in that everyone's been open to, collaborating and discussing and suggestions and ideas, but then also me learning from them too. I'm not a teacher, that's different, that's a whole different wheelhouse. And so just that collaboration, and not only with the teachers, and I think it's all of the above, a reading interventionist, special education teacher, general education teacher, but also with the school psychologists, and even the occupational therapists. I mean, really, it's truly a team support, and the parents. I mean, in the schools, I find it harder when I'm versus my private clients versus the students I work with in the school. I'm obviously in communication a lot more with my private clients. I see the parents, where at school, you're not, but I think keeping that in mind too, that collaboration with the families as well, is so important.
Because we do wear so many hats, right? in a school setting or even in a private setting. So sometimes that, or a lot of times that even just opens up the door for like divvying up goals. We've seen a lot too, where our speech and language goals look really similar to like the reading goals that they might have under their ELA section of their IEP. And so divvying up things that way, we're getting max repetition, max exposure. Is always a great plan for these students. And it kind of helps us too, right? Where we're not trying to have to do all of these things. We've made a plan with the rest of the team, and they're going to cover this and they'll help this. And so good things come from that for sure.
Yeah. I think too, sometimes, looking at those goals, and like Karina said, a lot of times they're very similar, or they at least support each other. But then I often see, especially in our older students, where their reading and writing goals, like they have a goal for reading comprehension and reading fluency, but they're still completely missing those basic reading skills as far as just decoding and phonological awareness, but there's no goals for that. And so that's where we can really come in, especially when it comes to like the phonological awareness, and support that too, or at least advocate for some of those goals. Because I can't tell you how many times I've had a student come, where I've looked at their IEP, or even in the schools, when they go to write the goals for a second or third grader, the goals are just reading comprehension. We'll answer, WH questions after reading a grade level passage, or read so many minutes or so many words per minute. And I was like, okay, yeah, but that's our end goal. But how are we addressing their decoding skills? Because they're not going to be able to answer those questions if they're focusing so much on what they're decoding, but there's no goals to address that. And so I think that's another piece where we can at least advocate for that, or somehow try to support those goals as well. So we've talked about 3 elements of structured literacy so far. Phonology, which is well within our wheelhouse. I think we're most familiar and even known for that. So teachers are going to come to us and ask for help with phonological awareness and phonology. And then we talked about sound symbol relationships and syllables. So the next area that we are pretty familiar with as SLPs and SLPAs is morphology. And so I think one of the biggest takeaways for morphology is we need to remember that we have to think about their phonological skills too. And we had one client specifically that stands out in my mind every time we talk about morphology, that this really was an eye-opener for us. Where we had goals for him. He came into our clinic, he had goals already. He had an evaluation. So we were working with him, and one of his goals was like regular past tense verbs, wasn't marking those. And so we were, addressing the past tense, and all of us, and he just was not getting it. And I don't remember exactly what happened, but we had another SLPA who was working with him. And I remember I was supervising her session, and all of a sudden I was like, oh my gosh, this student has no phonological awareness. And so I was like, okay, hold on, let's take a step back. And so we gave this student a phonological awareness screener, and he performed very poorly on it. And I said, here's the thing, like we're trying to teach him, what we're teaching him is to like these grammatical markers, you're adding a sound to the end of a word. But if he has zero awareness that words are made up of all these different sounds anyway, of course he's not understanding, of course he's not getting it. So we had to back up and take more of a phonological awareness approach with him versus just like that syntax or morphological approach with him. And so that was just kind of like a big eye opener for us as therapists, and then just kind of keeping that in mind. So I think for us, we're very aware of that, it's part of our education, the different types of morphemes. So we have our inflectional or our derivational morphemes. And how we can go about building vocabulary, and then even just building that syntax with that as well. But when it comes to more of the structured literacy, the piece we don't have as much knowledge about is when it comes to like those spelling patterns. And so, there are rules for when you're adding a suffix. And typically, like if you're adding a suffix like ed or ing that starts with a vowel, there are certain spelling rules and spelling patterns. Like if your base word ends with a Y, do you change the Y to an I, or do you just keep it and add the suffix to it? And there's also rules like if your word ends in a CVC, do you double that? So think of the word stopped, STOPPED. Why are you doubling that P versus a word like jumped? You're not doubling the P in jumped, you're just adding ED. So I know
these are things I have never considered ever.
Exactly.
I was today years old when I realized how completely ridiculous some of this is.
I know
it is. It really is. And some students really benefit from being explicitly taught those rules, but then other students, it's just too complicated.
Overwhelming.
It's very overwhelming. So we do have some resources, again, like on our Instagram, like in our bio, that just kind of like a cheat sheet of the most common like spelling rules and spelling patterns as far as like morphology, and then just other spelling patterns too that are commonly taught in these structured literacy programs, just for you to have. But I mean, again, when I got my training, I did my training through the Academy of Orton Gillingham Practitioners and Educators. It was a 9-day program. Like it was a 9-day training. And so, I mean, obviously it's way beyond what we would have time for here. But we do have like a cheat sheet as far as that. And then we have like a phonics practice sheet. And I don't know if it's linked in our bio, but you can always reach out to us too. And we can send that, where you have the opportunity to go through and practice a lot of these skills as far as like identifying syllable types, syllable division that we've kind of talked about, and then even using and then practicing some of these spelling patterns. So we have some opportunities for you to practice. Again, like Karina keeps reiterating, this is not for you necessarily to now turn around and teach, especially if you're in the school setting, but more so just that knowledge so you can better support these students, and then just have more knowledge as far as like the interventions that they're getting in the class too. But then for us privately in our private practice, like that's what we focus on. We are the reading intervention, when they come to see us. So maybe you want to take that route and you just want to learn more too. But as far as just getting a little bit of knowledge. So, and again, a lot of times we're already addressing a lot of these morphology goals. We have those syntax goals. We're working on verb tense. We're working on plurals, and adding those. But I think, again, adding that orthographic piece and really highlighting that is going to be helpful, just that awareness. And then also just, again, being aware of their phonological skills and making sure that's not something we've skipped over.
Some things that we've done to work on morphology in our speech and language sessions is it's always a big hit. We call it past tense basketball. And we usually have 3 baskets set up. And this is when we're working on like our past tense. So how it can sound 3 different ways, right? To the id, our past tense marker, as in, I can never think of examples, y'all. I'm gonna need some help. Like painted, walked, and jump. No, those are the same.
Hugged.
Okay, hugged. There you go. And then depending on what we want to focus on, do we want to work on that auditory awareness piece? So then maybe we'll verbally give our kiddos a sound and they have to isolate. So working on phonemic awareness, again, they have to isolate that marker and think about what they heard. And they have to shoot their basketball into the right basket and they get points if they get it right. Or we might be working on decoding, right? So they might have strips of paper with they're all spelled ED, right? But they just make different sounds depending on other parts of the word. And so then they have to practice reading it correctly, and then shoot it in the basket that it goes in. So it's great repetition, great drill. You can target different aspects of that. And we're supporting and addressing that morphology in there and thinking in some great phonemic and morphological awareness as well. That's always a big hit. And then the other one I'm looking at here, Heather, I think you made this one, like that book, the suffix book, like full, fully, lessly.
Yeah. So when we're working on some of those morphemes too, working on those suffixes and prefixes, some things that we've done with our students is we've created like little vocabulary notebooks where we add in, like we have the suffix or the prefix, the definition of what it is, but then we always draw a picture to kind of help with. So like one I have is Ly, L-Y, and our word that we used was slowly. That was our keyword. And so we drew a picture of a turtle. And so kind of but again, making it very specific, the child, like letting the student come up with it, because individualizing it and making sure it's meaningful to them is so important. And that goes back to those speech sound cues that we talk about, with some of our students that we've worked with. We love the Bjorn speech sound cues. We use those a lot. And we also do use like the lips pictures, but sometimes those don't click for our student. And so we let them come up with our own. And I don't remember if we mentioned this in our last episode we did, but Karina had a little girl and we were working on her F, and the mad cat wasn't working. We tried fish, just coming up with the keyword instead of the environmental sound. Nothing was working. And so her mom helped us come up with fart. And that was her keyword for, and it stuck. I mean, but we just couldn't, she could not. And so it's hilarious.
Whatever gets them there, right?
Exactly.
I mean,
Yes,
You think you should
and
see
if
the
you just-
picture.
it's so great, but it's just a great example of how individualizing and letting the student, like a lot of times we let them draw the picture, and some of them have come out really hilarious, like they draw the picture and you're like, what is that supposed to be? And it's a monkey itching its butt, and you're like, oh, okay for that itchy. And so, so I think it's important. And then just going back to morphology, same for that, when you're working any vocabulary, really, what do they picture in their mind for that? And that's what's going to help, because I mean, we can tell them things, but if it's not clicking for them, and that's another piece with those programs too, is they're very scripted, and tutors and people that are trained in it are trained, you do not go off the script. And I understand that as far as like the fidelity for it, but what if it's not working? Like, what if those keywords that are in that program are not clicking with that student because they don't have the background knowledge for that, or whatever, it's not meaningful to them. They need to be able to use what is going to be meaningful. And I think us coming in as clinicians, we have that knowledge and understand how important that is. So same goes back for that when you're just working on morphology too, and helping build that vocabulary.
I just want to say that all of the examples you're giving make it feel so easy to address literacy in what we're already doing. I'm just imagining a situation where you might have a student on your caseload that maybe you're working on speech sounds, and that's what your goals are related to. But then if you take that extra step to collaborate and find out if they do have some sort of services for literacy or need additional support for literacy, just tacking in those letters or putting in that extra step into your therapy program to tie it back to literacy. The way you're describing it makes it feel so accessible. Like it's not this whole extra thing you're doing. You're already doing it. You just need to tweak it a little bit.
Yeah. I'm glad you say that, because that's our goal. That's our goal. So
that is. And even if your student doesn't have goals for literacy, like it's going to benefit everyone. You're benefiting, everyone's going to benefit from that. And that's the thing, is not only students with dyslexia are going to benefit from structured literacy. All students benefit from structured literacy. So
I feel like that can funnel us into executive function. Can we jump to that EF piece really quick? Because no student's going to be at a disadvantage from being exposed to this in their intervention, right? Because what we're doing is making it multimodal. What we're doing is making it accessible to everyone, and just incorporating another neural pathway that's going to make an association, so no one's going to be at a disadvantage from us embedding phonological or phonemic awareness into our speech therapy. No student is going to be harmed in this therapy. Right. But it can be something simple that we embed and hit on that. And so I talked a little bit about executive function. I know it's not one of the formal 6 elements of structured literacy, but it's involved in everything. It's involved in our students' learning. So in a nutshell, executive function skills are like perception, awareness, attention, working memory, inhibition, initiation, self-monitoring, retrieval, right? What Heather was talking about, when that sound cue isn't working, what's not sticking for me is I'm not able to retrieve that information that I've learned and then apply it. And that's an executive function skill, or several together. And so we love to embed supports for executive functioning into our speech and language therapy as well. And so a few different ways we could do that is making things multimodal, giving them visuals of things, making things tactile, just individualizing it and finding what works for them. And then probably the most valuable tool that we can, I say valuable in that we can do the easiest and reach the most students without really having to, because EEF is can be a whole presentation on its own, right? And so without having to dive too much into that, something that we really think that we could do to support this is called reflexive questioning. And Tara Sumter is a SLP who specializes in executive functioning, and she has a book and she's extremely knowledgeable in this. And so we got this strategy, if you will, from her. And so it's the idea that our words matter and the way that we word things can support our students. So reflexive questioning really promotes self-reflection and self-awareness, which ultimately leads to that generalization, right? Which is what we want. And it doesn't give or tell our student what to do, but rather guides and models self-talk and teaches problem solving for them. So in our speech room, what that might look like when we're working on our coughing camel sound, and so maybe we are producing it and they make the t instead of just, nope, try again, that wasn't it. Some way we could use our words differently to put them into a reflexive question is, where did you feel that working? Where should you feel it working? Because now we're forcing them to think and to kind of get some of those self-talk patterns and self-checking, self-monitoring patterns in there. Another way another thing that could look like in our speech room is we have that kiddo that really can't sit still and is doing all this. And instead of sit still, sit down, that we're just telling them what to do, right? There's no thinking involved for them. Where should your body be right now? What's your job right now? What should you be doing right now? Because then that's going to force them to come back and be like, oh, wait, yeah, what should I be? And maybe they don't know, but then that's an opportunity to, so here's where you can ask. And so it's just great modeling, problem solving, making our kiddos more independent and less reliant on those external cues and more aware of their internal cues.
I think, and on top of that too, and I remember Tara talking a lot about this as well, is it's also just like their confidence. So if you say like, where did you feel that your tongue working? I felt it in the front. You're right. Yeah. So it's not like a, nope, you do it wrong, do it again, wrong, do it again. Where did you feel your tongue working? In the front? You're right. Where should you feel it working? In the back? You're right. Again, can you show me that? Show me it working in the back so they can get the, and so I really like the independence and also just that confidence too, of like affirming, like, yes, they're doing the right thing instead of constantly, nope, do it again, wrong, do it again. Because then that can just be super discouraging as well.
I think that those are such nice points to raise too, not only about shifting the student into a more reflective state, but also kind of providing a more positive environment for them to be in when they're practicing. Like those strategies seem, I can't remember exactly what you said, Karina, but the best bang for your buck in terms of, it's not a big change to what you're actually doing, but I think it benefits the student and your relationship in multiple ways.
Totally.
And similar to some of that integrating the literacy concepts, I don't know that would be a bad approach for anybody.
Yeah. We can go, you want to go into semantics?
So the fifth element that we'll talk about as far as structured literacy, again, is very much in our wheelhouse. So we won't spend too much time talking about it, but semantics or vocabulary. Again, I think the biggest takeaway for this, it goes back again to that orthographic piece and writing it out. There's a podcast episode with Dr. Mary Alt and Dr. Shelley Gray and Dr. Tiffany Hogan on the See Hear Speak podcast, and it just talks about working memory and word learning. And I've listened to the episode probably like 5 or 6 times because it's so good. But Dr. Alt has this really great quote in there. It says, we don't always do a good job of identifying when students have both like oral and written language difficulties, because what their research is showing is that kids that struggle both with oral and written language that they do have a lot more difficulty learning words. And so they just say by writing, even kids with dyslexia, by giving that orthographic representation of a word. So even think about that with sounds. We keep talking about that when you're working on articulation, match it with those orthographic cues too, that they're significantly better at learning those words when you have the orthographic piece too. So don't forget about that. When you're working on vocabulary development, write it out for all students, because it's just going to really benefit them. We have a really great resource that we like it's called From Talking to Writing. It's a book that we really love, and it addresses a lot of vocabulary and syntax, and even written expression. So it starts just, at vocabulary, goes into basic sentences, and then even into like multi-paragraph essays, scaffolds it to wonderful curriculum. We use it and adapt it a ton with the students that we work with in the schools and privately. So just a really useful resource for that. And then again, that just goes into syntax, something that we're probably already doing in our speech and language rooms as well. Again, we love the book From Talking to Writing to support this, but just writing it out. So we do a lot of, we start a lot kind of like bigger, working on phrases, like who phrase, what phrase, where phrase, when, and kind of building that way. And we literally cut out colored pieces of paper, who, what, where, when. We have a lot of examples of these on our Instagram. I know of videos of how we've used it, and really just showing how we can build sentences. And then we kind of break it down even smaller then into nouns and adjective, like those parts of speech, but we start bigger, with the who phrase, who did it, the cat, what did the cat do, ran, where did the cat run, in the yard, the cat ran in the yard. And then, then you can kind of go back and break it down into, okay, so what's your noun, what's your adjective, what's your verb. Another way we've kind of helped support even spelling like that is we will have like on the whiteboard, and we make 3 columns, maybe like noun, adjective, verb, and then we give them a word, maybe like a specific target spelling, like phonogram that they're using. And then we use it in a sentence, and then they spell the word like in that column, as far as like, was that a noun? Was that a verb? Was it an adjective? So just another way to just really support those syntax skills, but then also supporting their spelling as well. And just that sound symbol piece. So those are the 6 elements. So again, phonology, sound symbol, syllable, syntax, semantics, and morphology. And 4 of those 6 well within our wheelhouse. And then the other 2, sound symbols, I think we have a little bit more knowledge. Syllables and syllable division, syllable types might be a little bit more new, but again, we have a lot of resources to kind of help you understand that. And then the last piece we always are encouraging, or that we do address or encourage you to support, is reading comprehension and written expression. So we've talked a lot about the reading comprehension already. This really ties heavily into your executive function as well, as far as self-monitoring, really using active reading strategies. Building background knowledge is going to be really important for these students. Sometimes, with some of our students, we've created these like active reading checklists, for that visual support to kind of help them, check in, review questions first. So we talk about background knowledge. We kind of do a scan of what we're about to read, looking at pictures, headings, pre-read, and in comprehension questions that we have. And then as we go through and we read whatever we're reading, we have check-in points where we kind of stop and do some self-reflection. Okay, what did I picture for that? What am I reading? And just using, and then kind of going and answering your questions then. And then again, for written expression, we use lots of visuals to kind of help as far as like the writing process and organizing your thoughts. A big thing we really encourage our students, don't stop writing. They'll start writing and they get stuck on spelling a word, and then the rest of their sentence is gone. They completely lose their train of thought. We have one girl that we worked with for a while, and she was, I think it's 7th, 8th grade at this time, and Karina was doing like a writing task with her in their session, and she was, I don't remember what it was, but she wrote the cook's room.
Write instead of kitchen.
And Karina was like, the cook's room, and she's all, well, the kitchen, but I didn't know how to spell it. And so completely avoiding, and changing their sentences.
And it didn't sound as good, right? That wasn't as nice of a sentence for her. And
so really we're working on just like teaching them, it's okay, like just get it down and then we will come back and we'll edit later, but it's hard because a lot of times kids with dyslexia, they also tend to be perfectionists too. So it's hard for them, if they're not getting it, right, or it's not exactly the way it should be. And we had another boy tell us one day, he's like, I have my thoughts here, like they're here, but then it's like, as it goes down and gets to my hand, it gets lost. And then he just like can't get his thoughts on paper. And so like, just to have him be able to like verbally express that was like really helpful for us, like what could we do to better support him then? Because it's not like he doesn't have the ideas, he has them, but it's when he goes to get it on paper, he loses it. And you hear that all the time with your students with dyslexia. So really supporting that written expression, scribing for them so you can get it, you can get it down. That's often a big support or an accommodation on their IEP as well. But just really encouraging them not to worry about spelling. So and I think that's it. We talked about executive function. So again, we're not saying that you now have to start adding all of these new students onto your caseload, because we get that a lot
goals,
too.
like new goals.
Yeah, but just being aware of the students you have on your caseload and how you can really support them with these structured literacy elements with the therapy that you're already doing by just adding in some different elements or kind of tweaking your activities that you're doing with them.
You all have shared so much with us today. I can't tell you how much more accessible this all feels now. And we're really, really grateful for you sharing it all. Do you have any additional last set of recommendations or words of wisdom that you want to leave our listeners with?
I think it's just that I really, and for myself personally too, is just that we're lifelong learners. And sometimes it can feel like, oh, you're asking me to do what? Because I remember learning these spelling rules at one point, and I felt the same way. But to know that we have look at the bigger picture, and that we can play a bigger role in the with these students in our existing role.
Yeah.
And that hopefully we spark some interest for some speech therapists that really have a passion for literacy, maybe.
Yeah. And I think especially in your kindergartners, because again, they're the ones we are most often the first professional that comes into contact with these students that are going to have, learning difficulties, specifically in reading and writing. And so really just being more aware in our younger students, because we're the ones that can really make that impact early on, because most likely they're not going to get tested or formally evaluated until later on. So especially in those younger students, just kind of come up with a good action plan of how you can better support them and be aware of them on your caseload.
Thank you so much for all of this. We're so grateful for your time. For anyone listening, all of the references mentioned will be listed in the show notes. Thank you again so much for being here, and we hope to welcome you back here again sometime soon.
Thank you.
Thank you so much for joining us in today's episode. As always, you can use this episode for ASHA CEUs. You can also potentially use this episode for other credits depending on the regulations of your governing body. To determine if this episode will count towards professional development in your area of study, please check in with your governing bodies, or you can go to our website, www.slpnerdcast.com. All of the references and information listed throughout the course of the episode will be listed in the show notes. And as always, if you have any questions, please email us at info@slpnerdcast.com. Thank you so much for joining us, and we hope to welcome you back here again soon.